Crohn's disease by Ollie Kerwin and Rachel Alpo. Crohn's disease is an inflammatory bowel disease, or IBM, that can affect anywhere in the digestive system.
This is Susan, a 25-year-old female who smokes. She has a brother who suffers from Crohn's disease. She recently has been experiencing diarrhea, weight loss, and has been having a fever.
Worldwide, Crohn's disease affects 1 in 350 people. Canada has the highest rate, where 1 in 150 people suffers from Crohn's disease.
In the intestines, there's normally a thick mucosal layer which acts as a barrier against microbial invasions. You can also see monocytes, which respond to inflammation signals and can quickly get to the sites of infection in the tissue. They then divide into macrophages and dendritic cells and produce an immune response. Crohn's disease is thought to be an autoimmune disorder, where the immune system does not distinguish between healthy tissue and antigens. As a result, the body attacks and destroys normal tissue. Since your body thinks it's trying to fight off an antigen, an abundance of T cells can be seen. Neutrophils are also present. They are the first phagocyte to arrive at the site of infection. Monocytes are also present, which produce interleukin-1 and create fever. Cell membrane is also disrupted when the epithelial barrier no longer works properly, allowing for microbial invasion. Proteins are also involved since the genes provide instructions for the making of these proteins that are involved in the immune system function. These variations may cause a disruption of the cells in the intestine to respond normally to the bacteria. An abnormal immune response may lead to chronic inflammation and the digestive problems experienced by those who have Crohn's disease. As mentioned earlier, Crohn's disease may affect any area of the digestive tract, but occurs most frequently in the small intestine, particularly the terminal ileum and sometimes the ascending colon. Skip lesions can be seen when inflammation occurs in segments that are clearly separated by areas of normal tissue. Initial inflammation occurs in the mucosal layer with the development of shallow ulcers. The progressive inflammation and fibrosis may affect all layers of the wall, leading to a thick, rigid rubber hose wall. This change leaves a narrow lumen, which may become totally obstructed. Adhesions between the two loops of intestine may develop from inflammation. Ulcers may penetrate in the intestinal wall, causing abscesses to form. Fistulas, a connection passage between two structures, may form as a result of the ulcers eroding through the intestinal wall. These can be found between two loops of the intestine in the bladder, or the intestine in the skin. As mentioned earlier, Susan has been experiencing diarrhea, weight loss, and has been having a fever. The exact cause of Crohn's disease is still unknown, but she may have been experiencing diarrhea from inflammation, which increases motility. Inflammation in the small intestine can also interfere with the digestion and absorption of nutrients. Incomplete digestion of food may travel through the colon and cause diarrhea. Weight loss can also be linked to the disrupted digestive system, and a fever is experienced because of your immune response.
Although there is no cure for Crohn's disease, the following treatments are used to manage it. Medications. Anti-inflammatory medications treating Crohn's are designed to suppress the immune system's abnormal inflammatory response that is causing the symptoms. Diet and nutrition. It is important to maintain good nutrition because Crohn's disease reduces appetite. Surgery. As many as 2/3 to 3/4 of people with Crohn's disease will require surgery at least once in their lifetime. Summary. Proteins. Genes provide instructions for the making of the proteins that are involved in the immune system function. Homeostasis. Normally in the intestine there is a thick mucosal layer which acts as a barrier against microbial invasions. In Crohn's disease, the immune system is not able to distinguish healthy tissue and antigens, so the body destroys and attacks normal tissue. Cell membrane. Cell membrane is disrupted when the epithelial barrier can no longer work properly.